In this video, I would like to discuss different types of seizures as well as the mechanism of action of medications that are used to control seizure. So seizures are due to the sudden abnormal discharges of electrical activity in the brain. And if someone has recurrent seizures, then that would be a diagnosis of epilepsy. And so these patients may present with an aura, which is usually an olfactory sensation, like for instance, smell of a burnt plastic, before they develop seizures. So common causes of seizures include metabolic or electrolyte imbalances, like for instance, hyponatremia or hypocalcemia are common causes of seizures. Brain tumors with elevated intracranial pressure is another cause of seizures. Other causes include ischemia, like cerebrovascular accident or transient ischemic attack, drug toxicity with cocaine, drug withdrawal from alcohol, benzodiazepines, or barbiturates, as well as eclampsia. So patients that have preeclampsia, which means that they have pregnancy-induced hypertension with proteinuria and edema after 20 weeks of gestations. If these patients develop seizure, then the diagnosis would be eclampsia. So the terminology changes from preeclampsia to eclampsia. And then septic shock as well as meningitis are other causes of seizures. So next, I would like to discuss different types of seizures that are there. So partial seizure is only affecting the temporal lobe of the brain versus generalized seizure, which is affecting the entire brain. And so partial is divided into simple as well as complex partial seizures. So the simple partial seizure is associated with an intact consciousness. So unlike the other forms of seizures where the patient loses consciousness, with partial simple, these patients do not lose consciousness. And then they usually present with like changes in gustatory sensations, like as if they're riding a roller coaster, or may present with transient unilateral tonic-clonic movements. Complex partial seizure, on the other hand, is associated with impaired consciousness, and these patients have purposeless repetitive movements, like for instance, lip smacking or chewing. And then generalized seizures are divided into grand mal, also known as tonic-clonic, and grand petite, which is also known as absence seizure. So grand mal seizure is usually also associated with tongue biting as well as incontinence. And these patients present with rigid trunk and limb extension, which goes for tonic movement, as well as jerking of limbs, which goes for clonic. So tonic means that they are having rigid trunk with the limb extension, and clonic goes for jerking of the limbs. Versus grand petite or absence seizures, where the patient disengages from current activity and stare into space, which can last up to a few minutes. And then one other important feature of absence seizure is that these patients have no post-ictal confusion. Versus the other forms like complex partial or generalized grand mal, which have post-ictal confusion, patients with absence seizure are not confused after the seizure. And then for the treatment of patients with absence seizures, first line treatment is ethosuximide, while second line agent is valproic acid. The rest of these conditions, grand mal, complex partial, or simple partial, all of them can be treated with carbamazepine. And then for tonic-clonic or grand mal seizure, in addition to carbamazepine, you can also treat them with valproic acid as well as phenytoin. So let's go over that again. Simple partial, first line treatment is carbamazepine. Complex partial, first line treatment is carbamazepine. Grand mal or tonic-clonic, first line treatments are carbamazepine, valproic acid, and phenytoin. And finally, grand petite or absence seizure, first line treatment is ethosuximide, and then second line treatment is valproic acid. Okay, now next I would like to go through the mechanism of action as well as the toxic effects of these medications. So ethosuximide functions by inhibiting the T-type calcium channels in the thalamus. And then the side effects of ethosuximide, for that we have a mnemonic called EFGH. So ethosuximide is associated with fatigue, GI disturbances, as well as headache. And then the next medication which is used for the treatment of the absence seizure is valproic acid. So ethosuximide is the number 1 choice, while valproic acid is the number 2 choice. And valproic acid functions by inhibiting the sodium channels as well as increasing the GABA concentrations. Now, side effects of valproic acid include thrombocytopenia, liver toxicity, neural tube defects due to the deficiency of the folate, and then also weight gain. Now here I have provided you with a memory aid to remember that ethosuximide and valproic acid are treatments of choice for absence seizure. So here you can see that this patient is staring into this space. And so staring spells are being treated with the ethosuximide as well as valproic acid. So on the table we have a bottle that has the name etho and acid. So ethosuximide and valproic acid are used for the treatment of absence seizures which presents with the staring spells. The next 2 medications I would like to go over are phenytoin and carbamazepine. So phenytoin and carbamazepine, both of them function by increasing the sodium channel inactivation. Same for carbamazepine. It functions by increasing sodium channel inactivation. Now for the side effects of phenytoin, here I have provided you another memory aid. So you can see that this figure here has a funny toes. The toes are inwardly turned, so it has funny toes. So phenytoin goes for funny toes, and then the side effects is gingival hyperplasia. So you can see the gums are having hyperplasia, and then diplopia is another side effect of phenytoin. And so anytime you want to remember the side effects of phenytoin, just remember this image that the funny toes are presenting with gum hyperplasia as well as diplopia. Carbamazepine, which is also functioning by increasing the sodium channel inactivation, is associated with bone marrow suppression, and so agranulocytosis as well as aplastic anemia are the side effects of carbamazepine. Okay, now in addition to the seizures that I've just discussed with you, there are 3 other types of seizure that you should be familiar with, and these include the febrile seizure, which is due to the elevated temperature of more than 38 degrees centigrade in children of younger than 6 years of age. And the presentation of febrile seizures is the same as tonic-clonic or generalized seizures, and for the treatment of these patients, you will have to provide them with cold blankets to help bring down the temperature, as well as provide them with the acetaminophen to control the fever. The next condition is myoclonic seizure, which presents with a simple or multiple myoclonic jerks, and you will have to treat these patients with the valproic acid. And then the final seizure disorder we are going to discuss in this video is status epilepticus, which presents with an unremitting seizure that lasts for more than 5 minutes. And then active seizures are being treated by providing these patients with the diazepam, which is a benzodiazepine that facilitates the GABA A action by increasing the frequency of chloride channel opening. And then for the prophylactic treatment, in order to prevent future attacks of status epilepticus, you can provide these patients with phenytoin. So just keep that in mind. Status epilepticus is a type of seizure that lasts for more than 5 minutes. If someone has an active seizure, provide them with benzodiazepines, like for instance diazepam. And if you want to prevent future attacks, then you can prophylactically treat them with the phenytoin. And that concludes our discussion of seizure disorders.